The critical thing is that, first of all, we want to provide access to quality health care for all residents of Delta State, irrespective of their socio-economic status or geographical location. That's the primary motive. Now, that covers a significant disease burden of the state. We got that information based on the survey, the baseline survey we have done. But down the line, we've realized that there was this situation where we're having a lot of complications from diabetes. And we realized that majority of the cases did not even know they had diabetes. We're also seeing cases of complications for hypertension, stroke, and all that. And they did not even know. And the problem was that, one, the laboratory facilities to diagnose them early wasn't there. The screening services weren't there. And this will ultimately impact on the healthcare cost. So we believe that the only way to do it is prevention is better than cure. Identify them early and provide the treatment early and provide the support system early, so that we pick up all potential diabetics early. The early stages we pick them early, the bad cases we manage them early. Now, to do that, it's difficult to put up the facilities across all the hospitals in the state. So we decided to start with 3 in each of the senatorial districts. So one is here for Delta North in Obio, there's one in Owo-Lomu for Delta Central, and Uporoza for Delta South. But because in the Delta South is a large expanse in terms of the large geographical footprint, we decided to set up another one in Polobugu. So we're going to have 4. And not just that, that's for the primary level. At the secondary healthcare facilities, we're doing in Ekma, Warri, Agbo, and Ugeli General Hospital. That is at the secondary level. Eventually, we also do it at tertiary level. So the whole idea is that we ensure that, one, all potential diabetic cases in Delta State are picked up early. All those that are going to be predisposed to diabetes are picked up early, and we're able to provide them the treatment. Now, it involves, first of all, screening, mass screening of everybody. We just screen everybody. So if you are picked up as you're diabetic, we register you into the health insurance scheme. We now provide you the drugs free of charge, because we've been able to negotiate with SANOFI. SANOFI is going to give us all their medications at 40–50% discount. We will now give it to all our enrollees free of a charge. Not just that, when you go home as a diabetic, you're supposed to be checking your blood pressure, your blood glucose regularly. So we're going to provide them with glucometers and test strips. We're going to give them information so that even when they're at home, they know that they are supposed to continue the management. You give them dietary advice on what to eat, what to avoid, lifestyle changes and all that. So it's going to be a comprehensive hypertension and diabetic management, but at the same time still managing any other medical condition they have. So that's why what we're doing is that bring them into the health insurance scheme, where they can get the general healthcare service and specifically diabetes and hypertension clinic. We're also going to train 400 doctors and nurses on the latest management of diabetes and hypertension, and ensure that both the insulin, the drugs and everything they get is genuine. Because we also noticed that the reason why the complications were happening is that those that actually have those conditions, they are buying fake drugs and they are not aware the drugs are fake. So we're also ensuring that we're getting this drug directly from the manufacturers. So the drugs we're giving out are quality drugs. They are going to provide the care and ensure that we don't have any complications. And part of our mandate, first of all, is to reduce cost of healthcare. Part of our mandate is to leverage on the private sector to support our healthcare service delivery. Even in the basic healthcare provision fund, which we're about to start, is mandated there that we should partner with pharmaceutical companies so that the cost of drug is cheap. Because if SANOFI gives the drug to a trader, it gives it to another trader, there's always add-on cost before it gets to us. So when we get it directly, it becomes very cheap, it becomes affordable for the people. So that's why we went into this partnership. And the partnership is a long-term partnership, is not ad hoc. It works with both parties. Like every diabetic equipment and screening and chairs here were donated by SANOFI, completely donated by SANOFI. This event was sponsored by SANOFI. We will provide the media coverage, the networking, the facility, the personnel to do the training. So it's a one-on-one partnership. They bring their drugs at discount, we pay for it, we give it to our enrollees free of charge. So it's a long-term partnership that is synergic and ensuring that the patient is the final beneficiary. And not just when we say patients in the very rural communities. We want to ensure that no one is left behind.